Welcome back, everyone. Next up, we have VirExit Technologies, Inc. It trades on the OTC under the symbol VXIT and is a diversified company focused on innovative, effective, ethical, and safe products within the health, safety, and wellness verticals. Please welcome its CEO, Jim Katzaroff, and Chief Marketing Officer, Webb Barth. Welcome, gentlemen. How are you guys doing today?
Wonderful. Thanks for having us. I really appreciate the opportunity. Delighted to be here. So as the CEO and chairman of the board, we've been putting together a company that's identifying and screening some possible opportunities here. And one of the main things people want to know is we filed a Reg 1A statement in January. They want to know when that's done. And the good news is Connecticut came back with 4 questions. We've answered them. So any day now. Now, $5 million sounds like a lot. What are we going to do with it? People have been asking. So I'll tell you, we've got kinetic additives. In other words, people that need to help us do this all the time. We look for one international heavyweight to come on board over the next few weeks and join our posse. The ability healthcare product from our genius Patrick Netter. And we've got some very intriguing botanical healthcare products from that have got 6 different products. The compositions are all for skin and surface disinfections, as well as topical wound healing. 6 different product licenses from an Ivy League school. I finalized a subsidiary last week. We anticipate to be able to announce the details on that sometime in the very near future. We have this inventor is a member fellow of the National Academy of Inventors for her work to develop infection-resistant devices. We're the anti-Purell, which I talked about last fall, but it's finally coming together. And one other last thing on my side before I'll let Webb take over is that we are interviewing IR and PR firms. So I know some of you shareholders would like that. And now on to anybody who wants to talk structure and financials, you can call me after this. And now I'm going to have Webb Barth come on in. He's an ex-commander of the U.S. Navy, MBA and master's in marketing. 40 years of marketing. I think he helped market with Moses back then. He seems to know everybody. He did a lot with steel chainsaws, Eskimo pies, DigiPlayer, dozens of others. So we're going to wind up Webb, let him go. You're in for a treat because now for the star of the show, it's Webb. All you.
Thank you, Jim. Thank you. Good morning or afternoon, everyone, wherever you are. My name is Webb Barth. I've been a marketing planner for 40 or more years. And throughout my entire career, I really focused on new products and new companies and developing those things. And that's probably why I have a lot of gray hair, quite frankly. I worked on maybe 100 at one time or another. I funded 26 companies, run several of them, products from soup to nuts, started with consumer products, then did industrial products, machine tools, an insurance product, airline products, et cetera. And mostly my focus has been research, planning, funding, and marketing. During part of my career, though, I had an interesting time from the funding side. I worked for a venture company evaluating new companies and prospects and how difficult that is. But it was particularly fun because in the Seattle area where I live in the 90s, during the dot-com era, it's incredible what products and companies came through that gauntlet, and some that did survive, much to everyone's surprise in many ways. I'm going to present a pretty fast walkthrough of a PowerPoint, which is a lot of detail for a PowerPoint, but I want to give you an appreciation for the full scope of the opportunities for VirExit, as well as some of the incredible products and services that have come to us, primarily seeking marketing and distribution, which a lot of these companies don't have. They develop technology, but they don't really know what to do with it. So I think, though, the whole thing will give you a pretty good overview of what some of the opportunities are for the company. I think I could change. I'm not changing the slide correctly, but I will do it right away. So I figured out. Okay. So Ryan's a stupid question here, but the slide is not changing. Okay, maybe there it is. All right, thank you. Okay, sorry for that. About VirExit. VirExit primarily has been aggregating unique technologies and products, many of them emerging because of the COVID threat, and pulling them all together, and most of them to address problems that businesses have, which are pretty serious, as we all know. Some of these problems actually, or most of them, have to do with COVID and viral protection, et cetera. But there are some products that workplaces are dealing with as well as weapons or problems with drugs and other types of things. And there's some technologies that have come to us that are particularly good in that area. So we've been aggregating all of them and trying to bring turnkey solutions to businesses, which caused us to create the products division, programs division. And the programs division is pretty much focused on industries with particular problems. And you can imagine who they'd be: movie theaters, cruise ships, airlines, health clubs, et cetera. And these programs are pulled together, and then we use professional consulting to figure out what are the best things to use. What 4 different things should we do to make sure that health clean is sanitary and safe, et cetera. And then along with that, we're working with a health consulting firm who will certify that this health club is safe because it's following this protocol on a regular basis, et cetera. And here's just some of the markets in North America alone. And we're finding, of course, this is very much an international marketplace, but there's just some of the markets we're dealing with. Let's talk about the big question most people have, which is, well, okay, that's great. You've got COVID solutions and other things, but what's going to happen in the future? Is there going to be a market for what you do? Well, based on a lot of different data, and of course this varies greatly by part of the country, kind of business, about 20% of consumers are going to make serious decisions about what they do, what cruise ship they go on, what airplane they fly, based on COVID type considerations. So additionally, there are many businesses that are dealing with international type opportunities. And of course, things change internationally quite a bit. I mean, if you fly in an airplane from Des Moines, Iowa to Salt Lake City, maybe 10% of the people on the plane are going to be from countries, maybe those countries that have less than 10% of immunization. So this is not a U.S. problem alone. I mean, the contagion comes from many parts of the world, and you're apt to be exposed to it. And just looking at some of the industries we've targeted, the airline industry, which I know a fair amount about, actually has had a really particularly difficult problem. I mean, really about 6 months ago, about 90% of the population was concerned about flying on an airplane. And it boils down to about 40% are still concerned, and 20% of those are just not going to fly. I mean, I don't care if it's, their son's graduation, a funeral, a wedding, a high school reunion. They're just not going to get on an airplane. They're just not comfortable with it. Beyond that, though, some of the data said that about a third of all passengers, this is about 6 months old, said that they're not going to fly. They're going to wait 6 months before they get on an airplane again. This is a serious problem. And for the airlines, and of course, other industries, the same impact. And there are other industries that have the same kind of problem. People are concerned about any mass transit. They're concerned about Uber cars. They're concerned about trains. And of course, here's some of the impact on some of the other target businesses. Overall, about most businesses have hit about 30% loss in revenues, just kind of overall, and some much more. Of course, health clubs really took a pretty big hit. Honestly, over 50% of the revenues were lost by health clubs. Quite a few will never reopen. Hotels actually had over 50% loss in bookings. And they're even projecting now that in 2023, they'll still be off 20%. And then the cruise industry, we all know the problems they've had. They had a problem for quite a while, and we're addressing that as well. So, but you're down to a fact with about a third are very concerned, and maybe 14% will never cruise again. So that's the impact. So we've developed some targeted programs. Here's 5 that we're looking at right now, where we have some pretty good prospects here, and we're working on making arrangements with the suppliers, the vendors of these products and services as we speak. We have a lot of products and services. I could talk to you for 2 hours about some of the fascinating technologies that have come forward. Some of them are unique to us, and these are just a few, everything from detection to scanning to ultraviolet treatment to whatever. Some incredible technologies that we've found or have found us primarily because they don't have a marketing or distribution channel, which I'll talk about in a little bit. Our focus has been to take these programs and turn them into a marketing tool by telling people and documenting that with research that if you can convince people that it's safe to be on an airplane, or it's safe to be in your Uber car, or it's safe to stay at your Hilton hotel, then they're going to come your way, and we can document that. So now a health product program, which is kind of a low on the acquisition scale, becomes something that can increase business. And if you can do that, you can almost always find customer business. Something's changing the slides here, but not me. Anyway, I'm sorry for that. So basically, a health program that's promoted can have some big impact. If 40% of the people are afraid to fly, and you say, well, look, you might be reluctant to fly, but here's a mask that'll protect you 99.9% from any kind of viral infection you might run into on an airplane. Maybe half of those people will fly. That increases the market considerably. That's a lot of new revenue that'll now be fly because they're confident. The other factor, though, which is without a doubt, is it'll increase market share. There is no doubt that consumers are pretty smart right now. One study by the American Hotel and Lodging Institute says that 81% of hotel guests will pick one hotel over another comparably priced if one has a COVID program. So it is a consideration, and it can drive business. And that's the way we're sort of positioning what we're doing. Our approach in general has been, it's difficult to get companies to pay for safety programs. I mean, it's nice, but honestly, if money is tight, safety programs are kind of at the bottom of the ladder. However, if a safety program is one that'll cause customers, health club customers, passengers to come back on board, return, feel comfortable, and then you can always find money for revenue generating products and services. And that's the way we position what we do. One of the products we have is the most incredible thing in the world. And I'm going to tell you, you just have to take my word for it, that we have the most comfortable mask in the industry. It is a mask that uses a patented material from a company we've been working with. They had two masks. One was kind of uncomfortable, and one mask was a little heavy in the fabric. Another mask was a sport mask with very thin fabric. We put the two together and branded a brand name that we own, the Breathe Easy mask, and created literally the world's most comfortable mask. What's really neat about it is that it's as effective as an N95. And the problem with an N95 is it might be effective, but nobody wants to wear it for more than 3 hours. Passengers want to wear it on a long airline flight. A worker in the Dearborn Ford plant doesn't want to wear it. A guy on patrol on the border in New Mexico doesn't want to wear a mask like that. This is a mask you can wear all day long. As a matter of fact, people say, I put the mask on, I go from store to store, I forget that I'm wearing it. It's very thin, it's very protective, and we own it. And of course, it is the best mask on the market. And there's 28,000 mask manufacturers in China alone. So it's not a small market, but it's an incredible product. We went after the airline industry for a couple of reasons. It's a big market. I mean, some of the major airlines carry 200 million passengers a year. We thought what they might do is pass it out to first-class passengers because they're flying to India or some other high-risk kind of area, or whatever, and maybe sell them in coach. And most people don't realize that the airline industry really does not. Commercial airlines really don't make much money on airline passengers. I mean, it's an amazing thing, but most people don't know it. But most commercial passenger profit on passengers is about $10 to $20, and that's exactly the airlines have backed themselves in a corner over a year with pricing on the internet, et cetera. But they don't have a lot of money to throw around. They don't have money to give you a steak or even a nice deli sandwich. Those nickels and dimes are pretty sparing, but they could give it away in first class and could offer it. So even though it's better from a safety standpoint, airlines have been reluctant to really provide masks for passengers. They're almost content to get away with a 20-cent mask that gets them over the FAA approval. However, airlines will follow the leader. I mean, if one major airline recommends a quality mask, we have one that's doing that, they will follow like dominoes. But so far, airlines don't really want to get in the mask business. They're just kind of hoping the whole thing goes away. But another airline product that's popped up is flight attendants. And there is no doubt that we have a solid market opportunity here. When you consider the poor flight attendant is walking around a cabin now, you've got 300 people with no masks on, breathing, sneezing, coughing into the atmosphere, and that's where they work. Airline flight attendants wants the protection, especially a mask that's comfortable and especially masks that they can talk through and you can understand what they're saying, which is another big advantage for it. So we have 4,000 masks being delivered to one major airline next week. And then we've got two other large, so we'll be at 40,000 flight attendants. The beauty of that program is, what better endorsement is there for a mask? On a major airline, flight attendants wearing a mask, 200 million passengers will see that worldwide every year. And who knows more about masks than a flight attendant? That's what the average person would assume, because they have to work in the mask and they travel the world and be exposed to a lot of different things. Oh, there's a lot of opportunity in the airline industry with this mask, and it's just kind of emerging, but it's a different kind of market. It's a market where people are more serious about the mask they wear and can they wear a mask? Can they find a mask that they can wear all day long versus just some piece of junk, a bandana or a paper thing just to get through the door. When it comes to health club programs, we mentioned the health clubs were clobbered. Basically, over half of the members left. Many may or may not return. They were hit pretty hard. We basically put together a program with a nationwide company with 1,900 offices that can pretty much service anything in any zip code in North America. And we put together a program to service health clubs. It might cost $1,300 a month, but we'll put in a total protection program and we'll monitor it and promote it to their customers. Well, it sounds like a lot of money, but if in fact you could cause some people to feel confident come back again, you can see that that's a good investment. That'll cause people who are reluctant to come back and join. And here's sort of what the program looks like. It's pretty hard for me to read this thing. I'll just kind of just off the top. Basically, what we're saying is you can walk through a mist system that'll remove all the bacteria and all the virus that you might have picked up on an Uber, a car, a train coming to the health club. Off your face, your hair, your clothing, your shoes, your knapsack, your briefcase, you'll come in there and be sterile. Then you're going to step into an environment where 99.9% of the atmosphere in there is free of all viruses, et cetera. I mean, it's not a filter. It's a patented product that can basically provide a very clean environment. Then we will be sampling 24/7 to determine there's no virus in there. Then we have a service that'll come in to do some of the heavy cleaning, on your equipment, et cetera. We'll monitor that electronically. And as a result of that, we have a health company that will actually certify that this club is current with its present protocol and standards and a safe place for you to go, which is an advertisable, promotable difference. Then, of course, we'll give everybody the mask that they can wear while they're working out, or they can wear it at home, or they can wear it for year-round wherever they are because it's reusable. And the point being, a health club is going from this scary place to now the health club is safer and more secure than your own neighborhood, your own grocery store, probably even your own home. As a matter of fact, you'll be healthier just stopping by, even if you don't work out, than when you got there before. So it's a matter of dramatically repositioning the health club. The cruise ship is a similar situation in a tough situation. I mean, cruise ships, it's one of the diciest areas. About half of Americans don't think a cruise ship will ever be safe again. That's what the problem is. They've had the problem for a long time. It goes back to Legionnaire's disease, et cetera. It primarily has to do with the ventilation system. There just aren't a lot of windows on a ship, so to speak, and it all goes through the ventilation system. If you can solve that problem, you can solve 90% of the problem. But a cruise ship's pretty big. And most of them are about 1,000 feet long, 3 football fields. But they're expensive. I mean, whether they're filled or not, they cost about $200,000 a day sitting at the dock, both interest on an $800 to $1 to $1 billion ship, crew expenses, et cetera. So how do you get them on board again? Well, you have to do something dramatic. It's got to be more than HEPA filters. And we have a program. We think we can position the ship as our ships are the safest place on Earth. Our Emerald Fleet is safer than your own neighborhood. The SS Globe Star is now maximum health safety rating and rating C. And position a ship as that very thing, a super safe environment where you can go and enjoy and believe that that's a very promotable difference. And I'll talk about our progress there. On the cruise ship, what that might mean is, first of all, the environment on the ship, all the air on the ship is 99.9% free of any COVID, which is better than a filter because, if you're in a dining area and somebody sneezes at you and it goes out 6 feet, you're going to be infected unless it goes through the HEPA filter, and that's too late for you. But if all the environment kind of immediately attacks all the air, attacks these particles and kills the pathogens and knocks them down, then that's a different thing. We've got the sniffer to determine that. Then we have an FDA test we'll have access to this summer. It's a 15-second test. You basically can ensure that nobody on board, people on board before, the passengers, the crew, the vendors, and boarding passengers, nobody on board is contagious, which gives a lot of comfort, It's well before normal kind of testing devices, and there's a lot to talk about that technology. We think FDA will approve it this summer. Then the mist tunnel, of course, ensures that nobody steps on board the ship that has anything they're carrying on their clothing, et cetera, or even their luggage. And then, of course, we have masks. And the mask is a great thing for a cruise passenger. And it's big business. One of the cruise ships we're talking to is 70 million passengers a year. A mask is a small thing to give them. They can wear it shipboard if they want, but they certainly can wear it if they're going ashore in Costa Rica or Venezuela or other high-risk kinds of places. So there's a lot of opportunity with cruise ships, and they need it. They need the ideas. They need the help. The last section of, and not the last, but one of the important ones we're talking about is the whole weapons system problem, rather, and systems that can protect against weapons. About 2 years ago, the worst fear in the world was school shootings and church shootings. I mean, a big problem, and we became aware of a product that we'll talk about in a second. And actually, we started getting people excited about providing some protection against weapons. And then about 6 months later, people said, Webb, we'd be concerned about weapons if we can find a way to get the kids into school because of COVID. So they kind of went on the back burner. But now that we're back in up and running, we have access to a technology. That scanner you see on the left, like an airport scanner, is the only scanner in the world that doesn't use any radiation, doesn't use X-rays, doesn't use microwaves, doesn't use RF frequency. It only uses changes in the Earth's magnetic field, and it's very sensitive. And what that means, it's okay at an airport to go through an X-ray sensor, but if you've got school kids going in and out 200, 300 times a year through a school, you don't want them exposed to any radiation. And this is the only one that doesn't have radiation. On top of that, they've added some features so that it can automatically detect elevated body temperature. It can detect whether somebody's wearing a mask or not, if that's still important. It also can determine where that person should be in this building. Facial recognition has some questionable things, but if it's a girls' dormitory, wouldn't it be nice if the people that have access to that dormitory are in the database? And if not, they just simply have to press the doorbell and ask to be admitted. And then finally, it completes the facial recognition contact tracing system that everybody talks about. You can say Sue Smith came through this door at 8:01 on Tuesday morning, and she had a fever. And if she is contagious, well, this is where she was. You can track her. And of course, the big advantage of the system is now you can have, if you've got a high school and you got 6 doors and 300 kids charging through the door in a half an hour, you'd have to have a monitor at every door to check for these things. This will electronically set off an alarm. So one person might monitor 4 doors, and just the people that either have a cold or have a fever, rather, or have a weapon can be deterred to the side. And we're envisioning this for schools. Of course, it's a pretty simple kind of instrument. But we're actually thinking about it for the New York City subway system, which is a little daunting with 429 subway entrances and the amount of people that are going through. But it is the only system that can handle that kind of volume because it's just the way the system works. So in general, though, here's kind of the projects that we're working on, just a little bit over. The cruise program, we're working with 2 very large cruise ship companies. It's a very exciting opportunity, and they need help. There's big, big, big dollars involved with getting people back on board ships again. The ships are sitting there ready to go. They're either full or they're not. We have 2 rep firms, one on the West Coast, one on the East Coast. One is very close to the LA School District. The other one is very close to the New York School District. That's the 2 largest in the United States. We have other companies working with the transit system, and they're working on the subways. New York right now, they're scrambling since that gun shooting for a way to solve the gun problem in subways. And of course, all the transit centers in Washington, D.C., Philadelphia, the Barth system, they're all looking at this same kind of thing. What are we going to do here? Okay. And they're for hire car companies. They're pretty concerned. There's one company that has 2 million drivers worldwide that we've got a program for right now that is taking a look at that. They're concerned not only for the drivers, but passengers are concerned. So getting masks to drivers is one thing, but maybe making them available to passengers might cause them to pick, one company over another. We think so. We're dealing with one of the largest movie chains, a very daunting problem. It's just intuitively people think that's not a safe place to go. But if we could actually change the air in there and the atmosphere and the positioning of the movie theater as being a safe environment, maybe an environment that kind of sterilizes you and from any environmental pathogens, whatever you might have picked up on the street, is an interesting thing. So there's a lot of opportunity there, and a lot of people like to return to movie theaters. The cable companies and phone companies, there's a lot of companies that have in-home installers. We hadn't actually occurred to us. you want people to go into people's homes during a pandemic. The people are spooked. The workers are spooked. So getting masks, et cetera, to those employees, et cetera. There's 4 of them we're working on right now. And then there's a chain restaurant that we're working on. We're starting with 32,000. We're starting with employees, but they serve about 100 million people a year. It's from an employee standpoint, it's still, for the 500,000 employees, it's still a good start. There's a railroad that we're dealing with, about 16 million passengers. I've done some work with the European railroad system that many of them have 1 billion passengers. Railroads are prime environment for people wanting to feel secure and traveling, a mask at the least and some other things as well. Additionally, we have a continual stream of promising companies that come to see us. Many of them are a synergistic fit with what we're doing. They have technology we can use. What we're finding is these technologies, it's interesting to me. I'm kind of used to it, but kind of surprising. Companies hawk their entire lives to get FDA approvals, lab work, certifications, and then at the end of that, they kind of say, well, how do we sell this thing? What do we do now? So we offer a marketing channel and perhaps a little bit of funding to push them over the top, get that final approval in return for, some opportunities, exclusives, et cetera. Pledge change.
Well, okay. Webb, I hate to interrupt you, but we are out of time right now, so we're going to have to transition.
Well, I'm done. So, and just going to say, there's a lot of businesses, all
Thank you very much.
Most of them don't know anything about it. Thank you.
Well, thank you. We do have lots of questions for you that we'll send to you guys so you can answer on your own time.
Please do.
Join us again and give us some updates in the future. Thank you.
Thank you.
Okay, everyone stay with us. We're going to transition to our next presenter. We'll be right back.